Hello, my name is Brendan O'Farrell. I'm the president and founding partner of DCN Diagnostics.
And I'm Pat Vaughan. I'm the Chief Operating Officer here at DCN, and I run all our development programs.
I think it's important to remember that it takes time for infrastructure to get spooled up, right? So I think part of the reason that countries like Singapore, for instance, were so quick to respond in terms of their scaling their testing capabilities is the fact that they had established the infrastructure based on previous outbreaks, SARS, MERS, so that infrastructure was there. We can actually respond with the development of tests relatively quickly, and particularly on the molecular side. It's a matter of a few weeks perhaps to produce the first sets of primers to get assays ready, and then it becomes a scaling question and a validation question as to how good those assays are. And then it's a question of risk benefit as to how fast you deploy those, right? So I think when we're talking about kind of the recurrence of this SARS-CoV-2 pandemic, if you will, or more incidences, more flare-ups over time, it's important to remember that the infrastructure will be there, right? It's taken time to deploy it this time around, but by next season, the central laboratories will be spooled up and ready for it. The rapid testing infrastructure will be ready for it, and we'll be much better prepared.
Yeah. It's important to remember as well is that, we're obviously very conscious about what's happening here in the US currently, in Europe and many countries. But remember, this is a worldwide outbreak. Okay, it's present in countries that have zero infrastructure, absolutely no. So that's why it's going to be so important to keep fighting this virus over the long term, and that's why rapid diagnostic testing or lateral flow tests can be deployed to these countries without that infrastructure, so that it's not just one country becoming free of the virus. It's a worldwide problem. So that's all countries have to become the disease has to be controlled in all countries, and that's why it's going to be vital to get easy to use rapid tests into these countries that are really lacking the infrastructure that we have here in the US.
Yeah, one of the big advantages of the lateral flow based rapid diagnostic test system is that it has been so widely deployed. There are reasons that this is really possibly in many cases the only rapid test format that's used in low and middle income countries for many infectious diseases. The entire malaria testing paradigm depends on the use of lateral flow based rapid diagnostics because they've been proven to be so effective. They come at the right cost, they can be produced at the right volume, they can be made very clinically predictive and very diagnostically accurate. So there's a lot of reason to focus on the use of rapid diagnostics for the next wave. Once this starts to move into lower middle income countries in force, which unfortunately it's going to do, the response will likely depend on the presence of effective protein-based lateral flow viral antigen tests and serology tests.